All right, everybody please stand and join me in the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call this meeting to order at 6 p.m. Can I get a roll call, please?
Michael Cashman.
Present.
Thomas Wood.
Here.
Charles Costick.
Here.
Dana Isabella.
Here.
Daniel Bosley.
Here.
James Coffey.
Here.
And Katie Calucci, myself, present.
Is it Bosley,
It's
Anderson?
definitely Bosley.
Bosley.
Yes, thank you.
Bosley.
Is there anyone seeking to provide public comment this evening?
Me.
All right, if you wouldn't mind just coming up to the podium. I know you were last week, so you heard the whole spiel about public comment, so I won't repeat it.
Yes, 5 minutes, right? Yeah. And I'm okay to start?
You're good to start.
Great. Hi everyone, my name is Colleen Jackson and I am the Community Outreach Coordinator for the Cancer Services Program of Northeastern New York. We also call this program CSP. Our mission at CSP is to identify individuals who are uninsured or underinsured and provide them with free breast, colon, and cervical screenings. The Cancer Services Program of Northeastern New York is funded by a New York State grant and is contracted through CBPH, specifically the Fitzpatrick Cancer Center. We serve 3 counties, including Essex, Clinton, and Franklin, with a particular focus on the rural areas of these communities. January is Cervical Cancer Awareness Month, and if you didn't know, both cervical and colon cancers are preventable. Regular pap smears can detect cellular changes early, allowing for interventions before these cancers develop. Certain groups are more affected by cancer than others. For instance, Black women in New York State are more likely than white women to be diagnosed with cervical cancer and to die from the disease. Additionally, women in rural areas are less likely to be screened than those in urban areas, putting them at a higher risk for cervical cancer diagnosis. As previously mentioned, colon cancer is also preventable. CSP provides FIT kits for free, which are also known as fecal immunochemical test kits that detect blood in the stool. Patients are given these kits and they get to take them home with them in the privacy of their own homes, perform the test, and mail it back to the lab with a envelope that is already stamped for them. Our CSP case manager follows up with patients to provide their results, and based on the results, an appropriate course of action is determined, ensuring that no one is left behind. According to the American Cancer Society, the number of people diagnosed with colorectal cancer across the country has increased by as much as 2% annually since the mid-1990s among those younger than 55 years of age. They also project that colorectal cancer will be the leading cause of cancer-related deaths among 20 to 49-year-olds by 2030. That's only 6 years from now. Thankfully, we can take action against the diseases. Finding individuals in the community who need our services is of utmost importance. Spreading the word about Cancer Services Program is essential to reaching those in need. Keeping the communities within the North Country healthy is crucial. Everyone deserves an equal opportunity to stay protected against cancer. And again, I'd just like to let you know I am Colleen Jackson with the Cancer Services Program of Northeastern New York. I am the Community Outreach Coordinator, and if you or anyone you love, or anyone in general may need our services, please reach out. Thank you.
Thank you.
Thanks,
Thank you.
Colleen. Thank you. Thank you. Can we take a seat?
Do you have
Thank you.
Stand
And
there. Comfortable sitting.
they have a certain.
thank you for coming out, and thank you for that important public service announcement.
Thank you.
Is there anyone else seeking to provide public comment this evening? Seeing none, we'll advance the agenda. I just want to take a moment, some news that broke today. Our friend and colleague of the North Country, Assemblyman Billy Jones, has been appointed by the Speaker of the Assembly as the new chairman for local government. I think that is a really phenomenal thing. I already had an opportunity to speak with him. Congratulations, and it's just a good opportunity for partnership. One of the things that, before Billy was even in this role, as the chairman, we've been having a conversation specifically about infrastructure and the CHIPS program. But when we would get down and lobby for, roads and bridges and so on and so forth, but we've also been having extensive conversations since he's been in office about seeing if the state could begin to advance a very similar CHIPS type program for water and wastewater. It's one of the priorities of the Association of Towns. So I think it's nice to have somebody that we know down there. I just want to congratulate him publicly.
And I would say, Michael, it's not just that we know him, he's the perfect person to be the chair, in that he has that local government experience, both at village and at county level. So
Yeah, absolutely.
it's great to have somebody like that there.
Absolutely. This evening you have a handful of draft resolutions, minutes, replacement of 2 existing fuel dispensers for an RFP award. You have the Regal Cinemas license application, professional planning and codes consultation, consulting services award, the annual examination of the town fiscal records by the auditing committee, and then the request to attend the 2025 New York State Economic Development Conference. This is a new conference for the Planning and Community Development Department. This was identified last year as an opportunity to continue to advance the good work of the developer's guide, etc. Glad to see that they're able to attend this and fully support it.
For the physical records of the audit committee, does that mean we will be passing it next week?
Right now, I'm putting in a draft. It'll either be next week or the week after. So.
Because you said we might have 2 weeks.
I gotta look at it, but we're putting it on there for now, so that it's noticed.
Okay.
Yep. This evening, is there anybody seeking to provide any committee reports? I know that we're just getting started, and some meetings or any committee reports going once.
Yeah, I would just say a couple of things, just so everybody's aware. I'll send something out. We're all set up for it right now. We actually are going to sponsor a blood drive through CBTH, the blood donor center. That'll be held on 3/3 from 2 to 5 p.m. We're going to sponsor it at the May Courier Park. I had a discussion with Michael. We just thought it would be a little easier to use the park versus the main campus building. So, one of the first times I think we've ever done that, but I think it's a good opportunity for us to hop in and help the community. And I would say just a couple things from water, wastewater. We did meet the other day. Scott's working on closing out a couple of fairly significant grants, a couple $1 million worth. So it's just gathering up the last of the paperwork, so to get that submitted to make sure that we get our reimbursement. That's kind of the tail end of the water capital improvement plan. The one thing that is kind of unknown is May Courier is not fully online yet. We went through the test programs, et cetera, but they're still trying to iron it out a little bit. The weather this week kind of shut everything down because in order to run the test, they're going to have to open up fire hydrants, and this isn't a real good time of year to open fire hydrants. So but they'll be back at it as soon as they get a little better weather.
And they've been jammed up administratively with some of the changes over in the health department, etc. So it's no fault of the town. It's just really kind of fallen in this imperfect situation. So.
What was the date and time you said for the blood drive?
3/3.
Yeah, 3/3. That's on Monday, March 3rd. That'll be 2 to 5. try to catch people on their way home.
the only thing I'll say is that we are just getting started, have first meetings tomorrow, and then we head into next week, but I was pleased to see Jess on the Action for Health, meeting yesterday, presenting on, the DRI status, just presenting the project, and then they asked about Battlefield Memorial Gateway and where we're at, and so she did a nice little recap of where we're at and where we're going. So it was nice to see her, filling in that group on some of the work that we're doing here in the town. It was well received.
Anyone else? Going once, going twice? This will be one of the last meetings, they'll probably be short for a bit over the next couple of weeks. So with that said, we will adjourn tonight then at 6:10. Please drive safe, please stay warm.
So, you probably have the card, you want the card.
I definitely